Yeah, we are going.
Sir, we are live now. Shall we start?
Yeah. Shall I start?
No, sir. I shall not.
Sure.
So, good evening, doctors. I, Shumon, on behalf of Shield Healthcare, welcoming you all today in another interesting and important session with Dr. Sumit Hajra sir on management of postpartum Lochia discharge and subsequent infection also. So, it's my honor and pleasure to introduce sir. Sir is a senior consultant obstetrician and gynecologist and also gyne-oncologist at Hospital for Women Obstetrics and Gynecology Unit, R.C. Hajra Memorial Hospital and Dhanbad. And also, sir, apart from sir academic extensive experience, sir also trained in ultrasonography, advanced technique in ARTs, endoscopic surgery in gynae hands-on training in Bangalore, and advanced endoscopic surgery with laser. Advanced endoscopic surgery in gynecology, hands-on with laser application and updating training in Pune. And also, apart from that, academic activities also, sir joined many conferences across India for last, you can say, 2 decades. And sir also participated many workshop and also have some research experience in terms of papers in several national and international journals. So with this short introduction, I request sir to take over the session, and meanwhile I request all the participants for your active participation, and please post your queries on the QA dashboard of the Shield Connect page. So once the talk will be over, we shall have a short discussion on this topic with sir. So thank you very much, sir, for your valuable time once again in our platform, and handing over the session to you for further proceedings. Thank you very much.
Yeah, am I audible?
Sure, sir. Everything is fine.
Yeah. So first, let me welcome our guests, all the doctors and our dear colleagues, senior and junior members of gynecological fraternity, as well as medical doctors, as well as my friends like Dr. Sahid. He has logged in from Delhi, and I wish everybody a nice fiesta or a gossip or a talk on a very common topic. Generally, what we come across generally during our hospital days. First, foremost, I'll just tell what I'm doing right now. I'm CEO cum medical administrator, as well as looking after Hospital for Women, and the gynae wing is basically seen by me and my wife. We are trained in gynae microsurgery, gynae oncology, breast cancer surgeries, plastic surgeries, general as well as high risk obstetrics and general gynecological surgeries. And I take care of infertility a lot, as well as gynae oncology. My wife generally takes care of general and high risk obstetrics as well as basic gynecology surgery. And we are very few doctors till now. I am very proud to say that I take care of breast cancer surgeries also, and I do a lot of every week at least 3 to 4 ERM and ESRMs on breast cancer surgeries, level 2, level 3, note clearances, and everything is done by me. As my hobby, apart from my artistic and computer knowledge on modeling, and I do a lot of modeling for films, and also I'm a medical administrator, a lead auditor for a few of the ISO certifications. I'm internal auditor as well as now external auditor also for NABH. I'm Six Sigma Black Belter for health and healthcare services with management. I'm a lead auditor for certified quality assessor, as well as I've done my advanced finance management from XLI Jamshedpur. So at the outset, I just like to thank Shield Healthcare and its whole team, including Biplav Mukherjee, Mr. Saha, Suman Saha, and Raj Dev Kumar, all the people to take up such an innovative topic, because these are the topics nobody wants to speak. Like, who wants to speak on sanitary care and all these things? Who wants to speak on all these things? But they are the integral portion of any obstetric career of any obstetricians, which we fail to understand most of the time. So I just want to thank them again, just to giving me the opportunity to speak on the management of postpartum lochia as well as infection and its management. So basically, just to help them, those who are non-medical or people who have joined not from a medical background, puerperium is a period of 6 weeks following delivery of a fetus and placenta. It is that period taken for uterus and other part of the body system to return to the pre-pregnant condition. And also the lactation is initiated during this period only. Many changes do occur during the first 2 weeks of puerperium. So it is basically removal of the placenta affects the physiological state, and a rapid clearance of the hormones from the placenta as well as extracellular fluid. Human placental hormone disappears from the serum by 2 to 3 days, as well as human chorionic gonadotropin hormone is detected till 2 weeks. Later it slowly declines by 6 weeks. Alpha fetoprotein also disappears within several weeks of puerperium. The ovulation function gets back to normal. It remains low for first 2 weeks and then later it gets back. FHS and LH hormones, which are suppressed during the pregnancy, remains low for 2 weeks following birth, both in lactating and non-lactating women. However, gradual increase occurs after 6 weeks, means just after completing our puerperium. That therefore we can say puerperium can be considered a period of natural infertility. So dramatic decrease in size of our uterine wall brings close apposition or transformation of the uterus into a hard globular mass. This has the effect of applying pressure on the placental side and it prevents the bleeding. The diameter from 18 centimeter of uterus comes back to 9 centimeter, promoted by continuous action of hormone oxytocin from the posterior pituitary. So the uterine undergoes involution, and immediately after birth, the uterine weight, which is 1000 grams, by day 5, it gets back to 500 grams only. And at the end of puerperium, it is 50 to 60 grams, and it's no longer palpable abdominally. Uterine involution may be due to withdrawal of this placental hormone basically. It occurs due to 3 processes. First is ischemia, occurs as a result of collapse of blood vessels. Second, of autolysis. It's a physiological process by which the involution of the uterus is achieved, and breakdown of intracellular proteins by the proteolactic hydrolytic enzymes. And last is the phagocytosis. It is the self-killing of the elastic and fibrous tissues within the uterine and the endometrium and decidua, which was been stopping uterus from developing. So basically what we see, the big uterus, what we can see here, the moment after delivery, it comes into a subumbilical level. Then from the day 6, it starts declining. And after 6 weeks, it becomes an intrapelvic organ. And we can't see anything of it and we can't feel it. Only we can do it by pelvic examination. So what happens to the endometrium basically? Regeneration begins within 1 to 2 days of childbirth. As we see within menstruation, just following menstruation. In menstruation, what we see, only 40% of the decidua is shed off. But regeneration sets in within 2 to 3 days from the less 60% of the decidua, and it completes by 26 to 28 days, and then it goes for a separation. Differentiation into 2 layers, like superficial layers acts as a barrier to infection, and the basal layer source as a source to regeneration of the endometrial layer. Regeneration takes about 2 to 3 weeks, and the placental side regenerates slowly over 6 to 8 weeks, at least around. We can take it for 2 months. So what is lochia? Basically, lochia is a vaginal discharge after giving birth to excuse me, after giving birth. And the most unique capability of uterus is the ability to get rid of its debris remaining after delivery through lochia. So basically, lochia are the uterine decidual debris which are being shed off in periodical method within 6 weeks. The first lochia contains the blood, which contains mucus and uterine tissues. Normal lochia flows should stop within 2 to 3 weeks of postpartum. In general, lochia has got an odor similar to that of normal menstrual fluid. Lochia happens in 3 stages. First is the lochia rubra, what is the red portion of the lochia, and the red portion means it is the like near blood. Second is the serosal layer, where most of the RBC clubs and coagulates and forms RBC cells or WBC cells, or fibronectins are increasing in shape and size. Lochia alba, which is the last portion of the which is whitish, yellowish, or creamish secretions, they contain maximum number of immunologically active fibronectins and leukocytes and dimorphous pus cells. So Lochia rubra, first, it is the first discharge, red color near blood. This discharge contains large amount of blood and its debris, and it continues for a week generally. Lochia serosa is the second portion, which is the second discharge, and has got a thin brownish color, and it contains basically serous exudates, erythrocytes, leukocytes, and cervical mucus, and all the decidual leftovers. And it lasts until 10 days or 14 days of the delivery. And Lochia alba is a white. Alba is a white in Latin word. And once Lochia turns whitish or yellowish, it is typically last from the second to third to 6 weeks. It can contain few RBCs, few leukocytes, epithelial cells, cholesterol, fat, and mucus. So basically, what does Lochia challenges us? It is the challenge ahead of us, which we need to forecast, which we need to see, we need to procrastinate, because until and unless we procrastinate the whole thing, which may be coming, we may lose a major decision of diagnosis or infection or thing which may end up in a patient in losing. So what we should do? So excessive discharge, an average amount of Lochia discharge for around first 5 to 6 days is around 250 ml, and it continues for 28 days. Slowly it reduces in amount. So Lochia challenge is basically excessive discharge. It increases in the microbial load. It increases risk of infection, as well as it delays healing. So all these challenges basically are met with a proper taking care of the Lochia and its management. So what happens during this Lochia time? Bacterial colonization sets in. It is a sterile for first few days, 2 to 3 days. But after third day and fourth day onwards, where the blood and the bacteria, vaginal flora, they get access to the uterine structures, and the uterus begins to be colonized by the vaginal commensals such as non-hemolytic streptococcus and E. coli. These are all dangerous components. And common symptoms of bacterial infections are what we see just around 2 to 3 days after delivery: slight fever, external vaginal inflammation, itchy skin, vaginal inflammation, cervical inflammation, endometrial inflammation, excessive white discharge, sweating, heat or pain in around the abdomen, and a very hard or hot breast tenderness. So healing of the perineum is the first thing what we should think in a medical way. Perineum, and in perineum, most of the time around 20 to 30% of the delivery, they end up with episiotomy, and episiotomy is a planned surgical incision on a perineum and at the posterior wall of vagina during second stage of labor. Initially, swelling and tenderness may occur due to childbirth that may cause bruising or rupture of blood vessels, and by the 4th to 6th week of postpartum, the episiotomy or the laceration usually should heal. So cervix will be the mouth of the uterus. What we call as the cervix is bruised, swollen, edematous, and with little tone. And by the end of first week, cervix decreases in size and closes by the end of second week. Vagina is smooth, edematous, sprouting, and bluish. Vagina rugae appears after 3 to weeks when the hormonal estrogen progesterone predominance sets in. And I'm little sorry, like I'm little in detail because many visitors are from non-medical background, so just to ease their services, I'm going in little detail. Puerperal pyrexia. Puerperal pyrexia is a fever just after delivery. It can be basically due to genital tract infection like tender, bulky uterus, prolonged bleeding, pink or discolored lochia, painful inflamed perineum. Most common infection organisms are basically Escherichia coli, group A, Streptococcus, Staphylococcus species. Urinary tract infections may superlead with frequency in micturition, painful micturition, as well as hematuria. Rigors seen in cases of polynephritis. Most common infections like Escherichia coli, Proteus, and Klebsiella, they are seen along with pyelonephritis. Mastitis may be there, painful hard red breast abscess, nipple trauma, cellulitis, most commonly infective organisms like Staphylococcus aureus are there. Post-operative infection, like when we are going for following cesarean section, we see high risk of postpartum septicemia is seen, wound problems and fevers are there. Usually it settles, but generally we need to take care of it. Painful red suture line, tenderness on the deep palpation, lochia, pink or colored, we should be cautious. Again, problem of deep brain thrombosis is there, which is caused by venous stasis as well as swollen cuff. So generally in pubertal state, we should see the cuff muscle, all those things, and the tenderness is there within 2 to 3 days or a week. Other like viral infection and chest infections are also common during this time. So continuing preparatory, the thing what we need, the causative organisms are always aerobic organism, including beta hematolytic streptococci, Escherichia coli, Klebsiella, Proteus mirabilis, Pseudomonas, Streptococcus aureus, as well as Neisseria. And the second group, anaerobic organisms like bacteroids, Peptostreptococcus, Peptococcus, as well as Clostridium group. So management, what basically we need to see, we need to do a proper full examination of chest, breast, legs, lochia, bimanual vaginal examination should be done. Majority of the infection originate from the urinary and genital tract, caused by poor sterile technique and delivery with insignificant manipulation or over manipulation, overzealous manipulation, cesarean birth or overgrowth of local flora. So basically postpartum period, blood formula, the leukocyte level is high. The level of fibrinogen level increases during first week of postpartum. Menses begins at 6 to 8 weeks of non-lactating women. Ovulation can happen in 2 to 4 weeks in non-lactating women and in 10 to 12 weeks in lactating women. Postpartum hemorrhages compose 0.5% of total body weight. And if it is more than 1% of total pathologic, then it is called as pathological hemorrhage. So here what happens, postpartum infection within 6 weeks of anything infection, we label it always as postpartum infection. In any infection in around birth canal in postpartum period is always accompanied by a high grade of temperature lasting more than 2 to 3 days from last 10 days of postpartum. So basically, when we classify, we just classify in like 2 to 3 ways, like external, like internal, and infection restricted to the labor wound, like endometritis and postpartum ulcers. Infection distributed by the labor wounds to the nearby tissues like vulvitis, colpitis, paracolpitis, metritis, parametritis, local thrombophlebitis, adenectasis, and pelvic peritonitis. So basically, when we classify the postpartum infection, we can distribute it like distributed peritonitis, infectious like toxic shock syndrome, progressive thrombophlebitis, as well as anaerobic gas syndromes. So generalized infection and sepsis is also seen. So postpartum infections like gynecological diseases like chronic inflammatory disease, bacterial vaginosis, recurrent, spontaneous and artificial abortions, infertility, myoma, and endometriosis are the common sequelae of postpartum infection in our day-to-day life. Yeah, I'll come back to Dr. Shetty. You have raised a very nice, pertinent question. I'll just cover it up and then I will have a nice discussion on it. Wound infection and etiology. The Staphylococcus aureus is around 40 to 60%, 70% of patients. Enterococcus is around 30%. Streptococcus is around 15 to 20%, and anaerobes and anaerobic bacteria are 9%. So basically what we see, generally the treatment, first we need to complete the general therapy like antibacterial therapy, infusion therapy, immunotherapy, vitaminotherapies, as well as rheology therapy. Rheology therapy is nothing, it's a big word, but it's in a small way, it is just like adding pentoxyphenyl like tentral fort or heparin like the low molecular weight heparins. The treatment first stage is to clean the wound, drain the wound, open the wound, lavage the wound. Drainage and irrigation has to be done with hypertonic solutions. never with betadine or sablons. Genital tract or genital tract should never be used with cleaned with vitamin, and saline water is the best, like little lukewarm saline water is the best thing to treat. And if episiotomy is there, if there is an impending threat of dehiscence wound, we should open the episiotomy wound, allow it to get the base or the basal granulation tissues, reddish pink tissues, and then we can go for secondary suturing. So wound reflex, the local regeneration therapy, application of ointment as well as swabs are there. Many people, they keep swabs, ointment, liniment like swabs, and sometimes secondary suturing may be required. So use a proper sanitary pad is the postpartum period main crux. How best we can use the sanitary pad, and what are the sanitary pads what we should not use like in olden golden old ages. What we used to do, the old ladies, they used to keep all the like cotton clothes, wrap it, and then make a huge like pillow like thing and put it in the vagina and in around and tie it with a heavy rope. And even the stomach was also, I have seen patients coming from villages, stomach also tied with that same rope. And it's just like it was they were in prison to deliver a baby, and they are being treated like a prisoner. The whole thing is tied so that patient should not move. The patient should not move away with it. So basically, coming to the sanitary pad, this is another and the most important aspect of treating the lochia, or to taking care of the lochia, or to taking care of our mother, the mother who has brought us to this society. First thing, always we should, as a gynecologist, we should honor this lady has brought us to this society, and he's bringing another brother or sister of ours to this society. So the moment she delivers, we should give her the best possible thing. Sanitary pad and sanitary napkin is basically an absorbent device worn by a woman after the delivery. For men, when they are in retrusor stability or leaking syndromes are there, we use for men. Men or lochia men, what happens before menstruation or during menstruation or during the lochia discharge, this is the only thing which has to be a very, very sterile and the best suited material for the vagina. Because we should know one thing, vagina, vulva, they are very thin skin membranes are there. Absorption is very high from anything what we wear. So that is where the disadvantages of using the disposable pad, if it contains the harmful bleach chemicals like dioxin and phthalates that can be absorbed through the skin in genital area. They are the most treacherous material what is possible in this local or untreated or second grade or third grade sanitary pad which is available in abundance in our system. What is dioxin? We need to understand dioxins are the group of chemically related compounds that are persistent with the environment pollutants. Dioxins are the byproduct of chlorine bleaching processes that are retained in the manufacture of paper products like polychlorinated dibenzodioxin, polychlorinated dibenzofurans, and polychlorinated diphenyls. So dioxin, International Cancer Research Center has labeled it as a first-class cancer-causing agent to human beings. So whichever sanitary pad contains an iota of dioxin, or it is not being seen whether it contains dioxin, should be avoided. Like all our general paper-based or those untreated or unexamined or sterile clothes. Second thing, even the World Health Organization lists dioxin as one of the dirtiest dozen, a group of dangerous chemicals known for persistent organic pollutants. So now the hazards are seen within the levels. If it is more than 0.7 picogram per total quality equivalent of per kg per day, if it is there in the body, it will cause. And acceptable limits are between 0.004 to 0.076 picogram per total equivalent of kg per day of dioxin or phthalates also. Basically, second dangerous thing is phthalates. It is from the synthetic plastic material specially used as a liquid absorbent, and they release the VOC. VOC is the volatile organic compounds. They are basically endocrine disruptive chemical called phthalates, and they are phthalates, the diethyl phthalates, di-N-butyl phthalates, and benzyl butyl phthalates. They are also used as plasticizers in medical devices like feminine hygiene products, cosmetic, toys, and even child care products. So these phthalates are non-covalently bond plastics and released from and absorbed into the body by the inhalation, ingestion, or dermal absorption, thus resulting in systemic contacts. So this is also known to be developed, and it functions in it affects the development and functions of a cardiovascular, reproductive, and endocrine system. So again, the dangers of dioxin. Basically, we see these are all long-acting chemicals which remains within the body till the body responds with a cancer, cervical cancer, ovarian cysts, vulval tumors, uterine fibroids, breast cancers, or adenomas of breast. So now the solution to the problem is, first we need to isolate the problem. First we need to see that what all things they had led to all these things. Then the proper thinking has to be done. Then the bright ideas of solution can only come when we have seen through, like using a very sterile and a best packing production, dioxin and phthalate free production, good length, softer surface, and better absorbable area, higher and faster absorption with a higher quality absorption system, and best adhesive system. This can only be addressed by only one compound, what I have been using for last 20 years, that is Lochia pads. Lochia pads are the most certified and the best, and it passes all the quality tests in Japan as well as in American boards. As well as now in China also, a lot of examination papers are being there under my guidance, as well as in Korean population. Antibiotic infusion, hydration, induced irrigation, and one thing we as I said before also, the betadine and savlon may be like not touched during taking care of genitalia or any oozing wounds. Betadine and savlon, they add only the bad things to it. Pleasant color or nice design should be there while covering the vagina or a panty. Odor free and easy disposal wrapper should be used. So in concluding the whole thing, what I can see, the postpartum Lochia discharge leads to various infections. The hygiene should be maintained thoroughly towards the postpartum period. That means till around at least 3 to 4 weeks, we should be using the Lochia pad in and out, either like, because if for first few days it will be 270, a Lochia pad, one single pad can absorb 180 ml of blood. So per day, at least per a week, 2 pad is enough. After that, you can make one pad till around 2 to 3 days or 2 weeks or 3 weeks. Treatment strategies varies based on the severity of infection, how much we have diagnosed and what all things have led to us. And dioxin and phthalate containing sanitary pad must be rejected at any point. An antibacterial containing pad should be the choice. Thank you very much. And I think I didn't bored much because all the learned gynecologists, they might be bored, but I had to go in little detail. And I'm taking on the questions. Thank you, Dr. Sahi. It's very nice to see you after a long time. I think after 30 years, I'm meeting you. As far as Dr. Rekha Shetty ma'am has said, okay, fine. And that is the strength. My family contains 140 gynecologists throughout India. And we love and we respect our mother and sister and daughters because of them, what we are today. I wouldn't have been a great gynecologist until unless females are there. So obviously, my God is female. So obviously, I say a lot high about females.
Thank you very much. Thank you very much.
Thank you,
Dr.
sir.
Rakesh speaking.
Rakesh, very thank you, dear.
बहुत अच्छा एक्चुअल रहा लेक्चर.
Thank you, dear.
प्रेजेंटेशन बहुत अच्छा था और बहुत दिनों के बाद मैंने इसी तरह कभी भी हो तो भेज देना भाई लिंक.
मैं तो सबको भेजते रहता हूँ. प्लीज लॉग इन. मैं तो हफ्ता में 2 तो नेशनल और 1 तो इंटरनेशनल मैंने वेबिनार करता ही हूँ.
ठीक है.
जॉइन अस.
Okay, thank you. बहुत अच्छा लगा, बहुत अच्छा.
And taking care of Dr. Shetty's question, why Lochia is not talked about seriously. Lochia is always taught because what happens? The female patients, they move off from our side. Thank you, Dr. Ghanshyam. And again, another my friend from Patliputra Medical College, nice to see you, Ghanshyam. Just now, Rakesh Sai was on the
Yeah.
So very
Thank you.
nice
Thanks
to
a lot.
meet you all again.
Yes, definitely will meet.
Thank you, dear. And basically, when the female patient, they come from the rural city, they just want to go home because the pressure from their in-laws. See, whenever we see a patient, first thing the husband and the attendants, they come, kab chutti hoga. So that is why generally before, at least we should observe a patient for 48 hours because secondary PPH or primary PPH, before they set in, we need to set the patient okay with antibiotic and all this if it is required. Basically, if you can observe a patient for 1 week, we don't give any antibiotic at all. But we need, the moment the patient wants to go home, we need to give them antibiotics. Hi, Deepak Kamath, very nice. And well, very nice to see you, Deepak. Again, he's my batchmate from JNMC Bangalore.
Hello, long time.
Hello,
it's been a long
dear.
time seeing you here.
And Dr. Deepak Kumar is heading Srirampur Gynae unit in Maharashtra, and he's doing a great work. And I acknowledge his work also for this female care also.
Yes, true. We are doing well in our Loni, for our rural medical college, for our
That's
Loni.
true. And he has joined Loni Medical College also nowadays. Now he's doing a double
now
job.
I joined Loni Medical. I am professor out there.
Yeah, actually, that's what I'm telling you. He's a professor there in gynecology department. So welcome,
right.
Dr. Kamath. So nice
Thank
to
you.
hear your voice after a long time. And I'm missing.
Right. Same,
I think Katimani also logs in. I have sent a message to him also.
Okay.
So.
Chalo,
thank you, sir. It was nice presentation, and thank you all doctors. Suman sir, is there any question in comment box?
Yes,
you are there, like Dr. Rekha Shetty has asked, like
yes,
thales and dioxin. It is because our Lochia pad is made of cotton only, but it is a tested, treated cotton. So it is your phthalate and dioxin free. And cost is around 270 rupees per 8 pads. And more details can be said by Biplab Mukherjee and Sumanta.
Yes. Biplab, can you please take something?
Yeah. Any other questions?
Yes, Biplab.
Yes, sir. Sir, regarding Lochia pad is our sealed product, sir. Just I tell you 2-3 lines regarding our Lochia pad, sir. This is the actually, sir. So many pads available in market. This is nobody, everybody. But what is the advantage of our Lochia pad? Lochia pad first, this is the only product that super absorption polymer. It is absorbed up to 180 ml. Actually, whatever existing product available in market, the maximum absorption power is 30 to 40 ml. But our absorption power is 180 ml. So this is ensure comfortable and dryness. This is the one. Another advantage in our Lochia pad, we have added silver anion that help in prevent infection. Also far infrared rays that prevent inflammation and help to faster healing. The big advantage of Lochia pad is the only product that is the dioxin free. Already sir is into told so many things. What is dioxin? Dioxin is number 1 carcinogenic. Our Lochia pad is dioxin free. So this is our Lochia pad. And Lochia pad, sir, it is 8 pad content, and it is 8 pad price is 225 rupees. This is the, and Samir sir is using regular basic. Thank you, sir. This is for our Lochia pad. Thank you, sir.
Thank you, sir, for your valuable time and for such a nice discussion on this very interesting and important topic. Although sometimes it is somehow ignored or something is that. So thank you very much, and thank you, doctors, for joining in this platform with Dr. Samit sir for this nice presentation also. And in future also, sir, we will look forward for some valuable session with you in any other interesting area. So thank you very much, sir, and have a good day, sir.
Thank you.
Thank you, sir, once again. Have a nice evening, sir.
Welcome.
Thank you.
Thank you, sir. Thank you. So, sir, I am ending the program, sir.
Okay. Thank you very much.
Yes.
Thank you, Biplab, and thank you, Sumanji.
Yeah.
Thank you all doctors who have given
Other respected doctors
Thank you,
who have
Dr.
participated
Deepak,
in
who is the
today's
head in Loni Hospital, as well as Dr. Saki Rakesh Sai, Dr.
Yes.
Rekha Sethi, Dr.
Really, we are happy that sir, first
Pankaj,
time in speaker
Dr.
link, so many
Jaskiran.
doctors is joined. Thank you, sir.
Yeah.
Thank you all the doctors for
Yeah.
giving their
Dr.
valuable time.
Jaskiran, Dr. Dulera, Dr. Amulya, and I think our Dr. Brando boss is missing. Rajdev Kumar said thank you.
Thank you all. Thank you very much.
Thanks, sir.